Well, hello there. Thank you for joining me for this week's edition of Telile 24/7. I'm your host, Adam Cooke. This week, we take a look at two very different angles of healthcare delivery in Nova Scotia. The provincial government introduced new gender-affirming healthcare measures over the summer. The head of the Cape Breton Transgender Network, Veronica Merryfield, joins me later on in the show to talk about these measures and how she feels they may not go far enough to be able to address the concerns of members of the LGBTQIA two-spirit community. But we begin with the latest stages of Nova Scotia's treatment of the COVID-19 pandemic, and specifically what Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang, has to say about it at this particular stage of the pandemic. With public schools and universities and community colleges reopening this week, Dr. Strang had a lot to say about how the education system is handling things, especially in terms of mask mandates. But you'll also hear a wide-ranging spread of topics connected to COVID-19 over the course of this media availability, which was made available to Telile Community Television by Communications Nova Scotia and the Province of Nova Scotia. I'm one of the reporters that asked questions of Dr. Strang after his opening remarks. Let's hear those opening remarks right now.
We will continue to work with our pharmacies to deliver COVID-19 vaccines and booster doses to Nova Scotians across the province. This is a big task ahead of us, this fall program, along with ongoing vaccines for children under 12. But I have no doubt that Nova Scotians will once again roll up their sleeves. But we need to remember that while they are very important, vaccines alone are not sufficient, and we need to remember the other ways to protect ourselves and our communities as well. So public health continues to recommend to all Nova Scotians that they make the personal choice to wear masks when in crowded indoor places. That recommendation hasn't changed, even in late spring and throughout the summer. That is still a recommendation from public health. We continue to recommend that you need to stay home if you're feeling unwell and follow the online information about using a rapid or a PCR COVID test. And then if you are positive with either method, then using our online report and support process to report that positive result. That reporting is very important for you, so in case you qualify for early treatment and you can be identified and referred. But it's also important for public health from a surveillance perspective. Along with all the other protective steps that I was talking about, it is also important that we continue to be careful about how people gather, and taking extra steps to protect those who are at higher risk of severe disease due to age or medical conditions remains important as well. There is a lot more information on these protective measures on the government website, Nova Scotia Health Authority, and IWK websites. But I want to remind people that we have successfully used these tools over the last 2.5 years. So they should not be new to people. And I have confidence that Nova Scotians have the ability to kind of remind themselves about the serious nature of COVID and to pick up practicing all these protective measures for each other as we enter the fall.
Now, as I mentioned, I was one of the reporters that got the opportunity to speak to Dr. Strang during this media availability in late August. The issue has actually taken a personal turn for me, as I and my wife Kathy both contracted COVID-19 in August. We're both clear of it now, but there are some issues connected to COVID-19 that I still wanted to know, not only for our sake, but also for yours. So here are the questions that I asked Dr. Robert Strang, Nova Scotia's Chief Medical Officer of Health, during his COVID-19 media availability in late August. All right, thank you very much, Dr. Strang, and we appreciate you still being around to do these updates after all this time. Very sorry that you and your household had COVID visit not long ago. That was the case for me and my wife and our household as well, too. So after all this time, I finally have something in common with you. So I wanted to springboard from the comments you had made about the changing face of COVID-19 knowledge and COVID-19 response in Nova Scotia, just the idea that there aren't lockdowns happening and there aren't mask mandates happening, only recommendations, because that's where we are with the disease right now. We're still getting an average of 200 people testing positive every day in the province. And I wonder, just what is the metric now for any kind of change in public health policy, even over the course of what we do with masks? Is it 500 cases a day? Is it 10? Is it 1,000 cases a day? Is it severe sickness spreading through frontline healthcare workers? Is it severe sickness preventing schools from being able to have teachers there? What's the metric now for any kind of change or any kind of new action?
Well, a key thing, we look at a number of things, and a key thing, and we've talked about this even way back in February, March, that we are shifting, paying less. It's not that we ignore it, but paying less importance on the total number of cases, and much more looking at what's the amount of severe disease, what are the hospitalization rates, our ICU admission rates, and our mortality rates. Those are the ones that are critical to look at. And then we also look at what's happening across the country and globally. Are there new variants that are arising? How well protected are the vaccine? Are we protected from current vaccines against those variants? Are there suggestions that the new variants may produce more severe disease? So looking at the global epidemiology and what may be coming down the pipe, and then also looking closer to home, our primary piece is what are we seeing from the impacts on our healthcare system, and we do as one of the questions earlier, we do look at some modeling, especially around the modeling of, with all the information around what we know about the current virus and around what's likely be coming down the road in terms of impacts on our hospitals through the modeling. And that's been very helpful to do that, because as I said earlier, that modeling has been very good at predicting what's actually happened in our hospital. So that gives us a good, a strong sense of confidence on the modeling, and we'll continue to use that to as an important part of looking really at the level of severe disease and impacts on our hospital system.
This is in terms of the recommendations for delaying having vaccination doses if you've already tested positive for COVID-19. And I will admit, I'm asking this question as much for me as for anybody else, but I think it would help our viewers and everybody here to be able to get a breakdown of why, if you've contracted COVID-19 and gotten over it, you are recommended to wait a specific number of days before getting another booster. Well, what is the exact thinking there?
So it's based on the science, whether it's a recent infection or timing from your last dose of vaccine. All the science so far shows that if you wait that appropriate period, and again, for most people, whether it's from your last dose of vaccine or when you were diagnosed with COVID, it's 168 days at least. And for people 70 and above, moderate to severe immune compromised, 120 days. But getting immunized sooner, or sorry, I'll put it a different way, waiting that period of time, all the evidence shows that time interval is important to get the maximum immunity and benefit from the vaccine that you're going to get when you've waited that interval. If you get immunized earlier, you're likely to not get as strong or as longer lasting immunity from the vaccine.
Okay. All right. Thank you. We thought you might like to hear what Dr. Strang had to say to other reporters who were on the same video call. So here's the rest of that media availability, once again made possible by Communications Nova Scotia and the Province of Nova Scotia.
Dr. Strang, in light of what we know about the current situation, and by that I mean we've got kids going back to school, there's about a 50% only vaccination rate for under 12, and we have a very strained healthcare system at the moment. Can you talk about what modeling your office has done for the fall as it relates to COVID, and what you see as the potential best case scenario and worst case scenario for the health system heading into October?
So the modeling that's been done by really the acute care system to try to predict impacts on the healthcare system It's really based on, and the model, we've used that modeling throughout from the beginning and through all of 2022, and what we've actually seen in terms of hospitalizations, ICU admissions in the modeling actually has played out very closely to what the reality has played out closely to what the modeling would say. That those should stabilize as we're coming out of the current wave, and I think it's important to remember that. Yes, the healthcare system is under a lot of strain. It's not just due to COVID. COVID certainly has exacerbated things, but the number of hospitalizations of people ill with COVID has been, moderate, and certainly, as I said, much less in the summer than in the spring. What we're looking at, and there's no clarity, no certainty on this, is the possibility of having another significant surge of COVID-19 later in the fall or into the winter, and perhaps combined at the same time with influenza. There is no doubt, though, that situation would create significant strain on our healthcare system, but it's very hard to actually predict. Even with modeling is just based on some assumptions, and it's really hard to know what are accurate assumptions. So we're going to have to watch things very carefully. As we are coming out of the current wave, there will still be a fair amount of virus around in September and October, and we'll watch the epidemiology across the country, locally across the country and globally. The main question is, are we going to get another significant change in variant, or we're going to continue to have these Omicron-like variants where there is actually building more and more protection from vaccine as well as ongoing infection?
Thank you for that. And by extension, Dr. Strang, when your office is looking at what recommendations to make to the government, whether things should be, as you say, strongly recommended versus mandatory, to what degree are you factoring in the state of the healthcare system, the situation where emergency departments are closed or inpatients are at 100% plus capacity? How does that factor into your recommendations?
It's one of a number of factors. We work very closely with our clinical colleagues, both the NS and Nova Scotia Health and the IWK. Certainly, the Nova Scotia Health has a whole COVID kind of planning team led by Dr. Shelley McNeil, and we are in probably almost daily contact between public health and Dr. McNeil and all the other folks in the health authorities who are doing that planning. So it's an important factor, but it's by no means not the only factor we look at. So, but there is very close connection. We work as a single health system, and we have to certainly account for impacts on the health system. But we also have to remember, I think this is an important point, that tighter measures, restrictions, mandates carry their own set of negative impacts, whether they're impacts on health, mental health, isolation, those kind of things. We know those well now. There's lots of financial impacts, which ultimately impacts people's health as well, and having restrictions which may impact people's ability to access healthcare services for other health reasons. So it's complex and it's all about trying to find a balance between our overall goal is to minimize overall harms. That means harms from COVID, but the other side of the equation is harms that may result from the measures we're taking as well.
There seems to be a lot of concern among parents about back to school this fall, and it seems to come down to a question of assessing risk. What would your advice be to parents about sort of making that calculation of risk, particularly in terms of masks being recommended but not mandatory in schools?
Well, at an individual family level, our recommendation hasn't changed. We continue to recommend that students wear a mask in school, wherever possible. Certainly when they're in larger numbers in a classroom, on a bus, in assemblies, etc. But also it's very important that parents understand and students understand the importance of, if they're ill, especially with new cold or flu-like symptoms, that they need to stay home. And not just go off to school and arrange for testing for COVID as appropriate, as I said earlier. And because that's very important, keeping people who are ill out of the schools, out of our classrooms. but I think fundamentally, if parents are concerned, one of the things that certainly is very important for, especially against protecting against severe disease, is getting up to date with vaccine. So I am concerned that only roughly half of the 5 to 11-year-olds have had 2 doses of vaccine. That's a choice that parents need to make. So that, to me, that would be the starting point. Are you getting your child up to date with vaccines? And then when they're eligible for their booster, getting the booster. Fortunately, in the 12 to 19-year-olds, we have a very high uptake of certainly the 2-dose primary series. So there's better protection in those older age groups. But following all those personal measures, understanding the health of your child, if there's specific needs, and taking that in consideration. But at the starting point is vaccination.
If there is a resurgence of COVID in the fall, do you foresee public health going back to more frequent updates on cases and other data?
That's certainly a possibility. We're always looking at our overall response and what's appropriate for where we're at in the ongoing pandemic. And so all of the components, including our communications approach, we continue to looking at, and what is necessary. Increasing the frequency of updates and media briefings is certainly possible.
I wonder if you could flesh out the idea that you said off the top about complacency. Give us a little more detail of how you believe the society in general in Nova Scotia is just too complacent about where we are with COVID.
So, I mean, and that is not unique to Nova Scotia, and lots of people have written and talked about this, that I get it. We're 2.5 years in, people were tired, but I think they're interpreting the removal of mandates that COVID is over and that we don't need to do anything, which is far from the truth. As I said, across the country, including Nova Scotia, we've had a significant surge of the 7th wave. My own personal experience, I still wear a mask in crowded indoor places. I go to the grocery store, I wear a mask. But I'm probably one of the very few that are doing that. It's a minority. So, and talking with other people, lots of anecdotal stories about people. Personally, I've heard, still being infected with COVID and going ahead and going to the wedding, just regardless. So the anecdote plus all our experience across the country, I'm not the only one, is that we have, for lots of understandable reasons, we have far too many have reached the conclusion that COVID is no longer a big issue. Part of it is because of the impact of vaccines. So the vast majority of people aren't at risk for severe disease, but it's still a nasty disease. I had personal experience with it. I had COVID through my house a few weeks ago, and it's not a pleasant disease at all. None of us ended up in hospital, but it's still not a pleasant disease. But for many people, they're saying it's just, I'm not going to be sick, or, I'm not going to be severely ill. And so why do I have to worry? Well, there's lots of us in our communities who still are at risk for severe disease. So that is our collective obligation to do things, not just for ourselves, but for each other. So that's really my call to Nova Scotians, is that we're still in the middle of a pandemic. We still have to take this seriously. We don't need mandates and lockdowns at this point, but we still have all the tools available for us to use by choice to keep each other safe.
But isn't there room for confusion over all of this? For instance, it's my understanding that if the child has COVID, you recommend that they stay home. But now I think kids are allowed to can probably still go to school if they have COVID. And the other thing, I guess that was included in the news release today, is that COVID's going to be treated in hospitals the same as anything else. So is there a bit of a disconnect there?
So just because we have removed the legal requirement to isolate for 7 days, that was in place, but there was no enforcement of that. I mean, that's not really feasible to enforce. Even when there were mandates, it really relied on people doing the right thing. So just because the mandate is, we're still saying that people need to stay home when they're sick. And once they're feeling better, if they've had documented COVID, then when they go out, they should wear a mask for another 5 days or so. So the obligation sits with families and with individuals to say, if I'm sick, I need to stay home. I get it that there's lots of things we need to work at to build more supports for families, parents who have to go to work and struggle for childcare, and people who have financial reasons, and those are other parts of policy work that needs to be looked at. But fundamentally, the message to Nova Scotians is that if you're sick, stay home and test as appropriate. And just because we don't have a legal mandate doesn't mean you can just ignore that and say, okay, I have no responsibility, and it's okay to send my child to school. And on the other part, I mean, just around the treatment, I think people are, just because we no longer have COVID units, and then people with COVID infection are being treated for all their medical needs in the best place in the hospital for all those medical needs. That's not a step down in taking COVID seriously. People will get the medical attention they need for COVID and other illnesses that may be part of the reason they're hospitalized. That was really more from efficiency and of how NSH kind of aligns their resources. So the fact that we no longer have COVID units should not be interpreted at all that the health system is taking COVID less seriously.
Considering vaccination mandates for frontline healthcare workers, considering a number of other provinces have lifted them, I'm wondering if you have looked at whether, certainly considering the staffing shortages we have in our province, if lifting those in other jurisdictions has caused increased stress on the healthcare system, or have you looked at those other jurisdictions?
No, as the decision around vaccine mandates for healthcare workers, those are policy decisions that are made and continue to be made by the health authorities and the continuing care sector. Public health is not directly involved in those vaccine mandate decisions for healthcare workers.
You've obviously touched on the recommendation to wear masks in indoor crowded places. I just want to be clear, was it a recommendation from you to not make masks mandatory in schools, or was that a government decision?
That recommendation is for individuals and families. We did have conversations with my medical officer of health team around, did we feel that a mandate for wearing masks in public schools was necessary? And given where we're at with all the factors that we take into account, it was certainly consistent among my medical officer of health team, and I certainly agree with this, that it's not needed to have a mandated use of masks in public schools at this time. It doesn't mean that we at a point down the road where we might provide a different recommendation. And I know it's come up about universities. We did not make a recommendation to universities around their policies. Those are their independent policy decisions, but they're following the public health recommendation, which has not changed, which is we recommend wearing masks in indoor public places for all Nova Scotians where there's crowded places. Universities made their own independent decision on that we support. But we've also had conversations, as I said, around and are fully in agreement in the medical officer of health team that it's a masking mandate is not necessary at this time in public schools.
Thank you for that. And you said hospitalizations are down, and I believe, if I heard you correctly, cumulative mortality rate is below the national average, I think is what you said. I'm just wondering what your level of concern is given the current COVID situation and how the public is or isn't responding, as you alluded to earlier. How worried are you about the overall situation?
Well, I continue to take COVID very seriously. It still has the ability to have significant impacts on individuals, on families, on our healthcare system, and across all different kind of sectors. I take it very seriously, and my call to Nova Scotians today is for them to continue to take COVID very seriously as well.
You were talking about people reporting their positive test results from home. Do you have an idea of the percentage of people who are actually making the effort to report their positive test results?
No, we don't. I mean, that's very difficult because there'd be no way to figure out how many people are actually testing positive. But we continue to stress and do whatever we can to communicate to Nova Scotians through social media, through online, at the time they're actually getting rapid test kits. The importance of them to report any positive results and how they go about doing that.
The Nova Scotia COVID Dashboard Weekly Update doesn't list what data you do have when it comes to self-reported positive home test results. Would you consider putting that on that weekly update so the public can be more fully informed?
So we are looking at ways. We stopped doing that because there were a lot of flaws in the data. And I know I've had conversations as early as or as recently as yesterday with the epidemiologist team about how we can get some kind of somewhat reliable information from the rapid test results. So there's no point in putting up information that is impossible or to interpret. So we're looking at ways that we can put at least reasonably reliable information on the rapid test results. And once we get there, then we will look at that and give that more account when we're looking at our epidemiology, and also looking if it makes sense that there's enough validity to those numbers, we will start to report those publicly as well.
Dr. Strang, last week, 8 Nova Scotians died as a result of COVID infections. In June and July, between 9 and 15 families suffered a loss as a result of this virus. You have said many times during this pandemic, these are preventable deaths. I'm wondering, does your office think that these many deaths from COVID-19 are acceptable?
So we'd like to have as few deaths as possible. As I said earlier, our overall objective through the pandemic is to decrease overall harms. And I emphasize that because so we need to try to find ways to minimize the impact of COVID. But many of the measures we've used had their own set of impacts around that may even be contributors to mortality as well. So this is about a balance. But many of the tools that we help protect those who are at highest risk we need to protect them from being exposed in the first place. So that's around masking, around being careful about not going around people when you're feeling unwell, taking extra steps when you're visiting perhaps elderly relatives or other things. So many of the tools we have to provide as much protection as is feasible and realistic at this point in the pandemic are embedded in all those measures I'm talking to Nova Scotians about today. All of us collectively own that responsibility to protect not just ourselves or think about ourselves, but who in our communities is at increased risk from severe illness or even dying from COVID, and requires us to take extra steps to keep them protected. But I will say, when you look at our cumulative mortality rate, that it is well below the national average when you look at that. So I don't mean it by saying that. I don't mean at all to diminish the impact and the importance of people who have died, but it shows that the efforts we are making, have made, and continue to make in Nova Scotia are having a significant impact in preventing mortality.
But given what you've already said about complacency and your concerns about complacency, and what you and I and everyone else in the province is seeing in the grocery stores, in large gatherings, at what point do we get to say, okay, wait a sec, people aren't taking this seriously enough, and we have to go back to the protections that protected us over the past couple of years?
So, I mean, that would require a very substantive change in my mind in the virus, and having a virus that we have other ways that are very protective. Vaccines, starting with vaccines and all the other measures I've talked about. The stronger measures, mandates, lockdowns, and all those things, which were absolutely necessary in 2020 and 2021. In 2020, we didn't know much about the virus. In 2021, we were building protection from vaccines. We are now at a different point that, and also from what we've learned, all of those the tighter, stronger measures had their own set of significant impacts, whether it's mental health, as I said earlier, isolation, financial, economic impacts, all of which may contribute to ultimately mortality as well. So it's about finding a balance. But right now, and it's not, I'm consistent with my chief medical officer of health and other public health people across the country. Those strong mandates and lockdowns would not be appropriate from a public health perspective at this point in the pandemic. But if there is a substantive change, and that would essentially have to be a virus that is much wider spread, much less protection from vaccine, and much more virulent, then we may have to go back to those measures. But we certainly hope we'd never end up in that situation.
Can you address the risk of long COVID on our hospital healthcare system?
there's a lot of research that needs to be done to understand long COVID. It's certainly a reality. What proportion of people with COVID will get long COVID? Still really not clear on the rate of that. Certainly the estimates from the US are, that recent thing, 1 in 5, that's been kind of debunked and say that's, the research behind that wasn't really high quality research. And many people with long COVID, the research seems to be showing that within a year or so that they're pretty well resolved. So it's hard to predict what exactly the impacts on the healthcare system, but certainly there are going to be some people with chronic sustained symptoms from their COVID infection. And so there's lots of people with chronic symptoms from all sorts of reasons that we need to continue to find ways to build capacity, especially in primary care, to deal with those individuals.
What would the message be that you want Nova Scotians to take away from today's update?
To me, it's hopefully people have heard that COVID is still here. It hasn't gone away. We still has the potential to create significant impacts. We need to continue to take it seriously. And the tools that we have at hand that are very effective against protecting each other and minimizing the impact of COVID, we've had them for the last 2.5 years. We need to really pick up those tools and use them appropriately and properly in a much more robust way. We need to re-engage with the serious nature of COVID collectively as Nova Scotia and do, in my mind, a better job of using those tools, again, not necessarily just for ourselves, but in our obligation, I believe, to protect those around us who may be at greater risk themselves.
I did have one quick question about the new Moderna vaccine that's adapted to target the Omicron variant. And I know, Dr. Strang, that some folks were maybe hoping to hold out for that whenever it becomes available. So I was just wondering what your advice is to people wanting to wait for that bivalent vaccine. Should they instead be booking a booster as soon as they're eligible?
So we'll have a lot more to say on that in the next couple of weeks, because we're waiting for those bivalent vaccines to get licensed. There'll be, I know that, and then we'll hear the Chief Medical Officer of Health. We'll hear from NACI, our expert group on vaccines around these new bivalent vaccines and those kind of questions. And also then we have to understand, well, what's going to be the supply of vaccine and how is that going to roll out from the federal government to provinces and territories over time. And with that, then we'll be able to make decisions and then communicate that to Nova Scotians around who should get a bivalent vaccine. And that's going to likely start with people who are at the greatest risk, age or medical conditions for severe disease. And then for the rest of Nova Scotians who then should then start to make an appointment for the current vaccine. Our hope is that we'll get lots of bivalent vaccine and offer that to as many people as possible. So the exact recommendation about who gets what vaccine will have to wait, as we work through all those factors. What I will say now, though, is that people who are still have had their primary series and their first booster, don't go get a second. If you're 12 and above, don't go get a second booster now. Because if you do, then you're gonna have to wait then for 6 months, which now puts you well into 2023. It's much better for you if you wait and get an additional dose of vaccine as part of the fall program to give you your maximum protection when we're just before when we're likely to see the late fall or the winter surge. So wait, and then we'll have lots more information in the next few weeks ahead around who gets what type of vaccine and when they should try to access that.
2 questions about vaccinations other than COVID. So things like Hep B, HPV, and so on. Given back to school is coming up, could you provide an update on where we are on the school vaccination program? I mean, considering the interruptions of the last couple of years, are there any gaps in our coverage for those vaccines in school-age children?
In general, no. We have made it a priority that despite all the intensive efforts from public health to deal with COVID, maintaining as much as possible our school-based coverage through public health has been a priority, and working with our primary care providers to maintain as much as possible access to the routine childhood vaccinations. So in the last couple of, so for the 2021 school year and the 21-22 school year, we did catch up. So groups of students who perhaps we weren't able to do in the fall of 2020 were done later on. And we've made it a priority to then continue our school for the 22-23 school year. It's certainly a priority to maintain our school-based immunization programs moving forward.
Thank you. And for other vaccinations that are given outside the school setting, like I'm thinking the MMR vaccine, have we seen any dip in the number of people getting those vaccinations?
We actually we're building it, but we don't actually have yet the ability to have a robust vaccine registry to monitor on an ongoing way our vaccine coverage rates. So the best we have is some survey data from 2017, which I looked at recently. You wanted to look at what our polio coverage rates were, and they're good. They're almost 94%. But we're certainly aware that because of COVID and because of some other potential, challenges with accessing primary care, it's an ongoing discussion between public health and the rest of our healthcare system, especially our folks in primary care, that we were, looking at what do we need to do to make sure that there are still adequate access for those routine childhood immunizations as part of making sure that families and new babies and then growing young children have access to primary care in general. But it's a very good question. It's an important point that we're well aware of. Polio situation with polio in New York City reminds us that we cannot take our eye off the ball, off the importance of routine immunization for diseases that have been well controlled for decades.
So in much earlier briefings, it was said at the end of COVID and related restrictions would have PCR availability only in hospital settings. But I've noticed lately that pop-up testing is appearing again. What end of the testing availability spectrum are we closer to in regards to PCR?
Well, good question. We're really in that transition phase, and the transition from COVID, from the acute phase in the first 2 years to a true endemic phase, it's taking a long time, a lot longer than many of us would like. So it's important, certainly through the fall, that we maintain good access to PCR and rapid testing for those who develop new cold and flu-like symptoms, because it's important to know if they have COVID and in some places looking for influenza as well. At some point, when we really hopefully by this time next year, 2023, we're at a different place where we can take a very different approach to testing, and hopefully we're in a place where we can say, well, we don't need to know everybody who has COVID, and we can really focus our testing like we do with influenza on those where it makes a difference to their treatment. But we're not there yet. And a key point of that is one of the reasons people need to test is because we have early therapeutics for COVID. And it's important that if you do have COVID, that you know about it very early on. And that's the basis of our early testing, asking people to use the report and support. So if they would benefit from early treatment, they're identified and have access to those therapeutic treatments.
And once again, I'd like to thank Communications Nova Scotia and the Province of Nova Scotia for making the footage from Dr. Robert Strang's media availability of late August available to us here at Telile Community Television to be able to share with our viewers. Right now on Telile 24/7, let's shift gears to the LGBTQIA+ and Two-Spirit community and healthcare issues that they're currently facing. The Houston government attempted to address some of these concerns in July by introducing new measures for gender-affirming healthcare. However, the head of the Cape Breton Transgender Network doesn't feel that these measures go far enough, and Veronica Merryfield is preparing to address these concerns as the Standing Committee on Health for the Nova Scotia Legislature gets ready to welcome her in October. To talk about these issues and recent Pride events going on in Cape Breton, I spoke to Veronica Merryfield by Zoom. She's speaking to me from her home in Marion Bridge. Here's that interview right now. It's a pleasure to have you, and one of the reasons I did want to have you today is because it's been a busy summer in terms of issues regarding the LGBTQIA community and government response to the LGBTQIA community. I wanted to start with an announcement that was made by the provincial government late in July in terms of the provincial recognition of gender-affirming issues. And I wonder if you could speak to us a little bit about that, why that announcement was so important and what you felt when it finally came through.
It's been a busy summer, but to be honest, it's been a busy year.
True.
The announcement that the province made for gender-affirming healthcare is both significant and not enough. So significant because it does recognise that the Nova Scotia health system is making changes to gender-affirming healthcare for those that need it, and it is moving in the right direction. I think it signals an underlying raft of changes to come, but in that respect, it was a very small change to what the province offers, and whilst it does affect a lot of those seeking gender-affirming care, it doesn't go anywhere near far enough. But I hope that's a far enough yet statement, and it is something that I will keep pushing on until we do see more changes to better care for those that need it.
Well, let's talk a little bit about what you'd like to see and what's already been done. Essentially, can you summarize what's changed as a result of the announcement that came through from the provincial government late in July? Basically, what's different now in terms of gender-affirming health care for the community as opposed to what they had before?
There's a number of large system-based issues that need to be addressed, and this addresses one of those, and that's to do with the amount of gatekeeping that happens to allow access to healthcare. And this change brought about the reduction of one piece of gatekeeping, in that those seeking care no longer need to get 2 letters of recommendation, but only need to get 1. But it's only in a subset of the overall gender-affirming care. And the reason for that is that in practice, the certain parts of the health care delivery happen in Montreal, and Montreal is a different health system who still do require 2 pieces of or 2 letters from appropriate practitioners. So for those that are doing what they can do in Nova Scotia, it has reduced that to 1. But that is only, as I said, one part of the healthcare that needs to happen. There are a lot of other pieces to this that really need to be addressed. And a lot of that does involve the effects of gatekeeping, the amount of practitioners that somebody needs to see in order for them to move on that journey. And gatekeeping becomes a significant problem, not only because of the number of times that you have to get those kind of letters and approvals, but the amount of time it takes some of those practitioners to do that work, and for the huge wait lists that we have in accessing those people, and for the lack of those practitioners in Nova Scotia as well. So there's a lot to address. And then on top of that, those professionals are spread around, and rural communities outside of the HRM have a lot of difficulty getting hold of those practitioners. If the only chance you have to see somebody is to go to Halifax, and you don't have good income, then that becomes a significant barrier and there are other ways that the health system could do this. So, yeah, that's just one piece of the puzzle.
Now, I know there are some families and some individuals in our area that are looking at this question even as we speak. Obviously, it's not the sort of thing that you necessarily want to be public about, but I do know that some of these conversations are happening. Are you hearing this through your work with Cape Breton Pride and with the Cape Breton Transgender Network? Are you seeing right on the ground people having these kinds of struggles because, as you say, they can't afford necessarily to get to a major urban center like Halifax or to see the practitioners that would actually carry this out?
I think the quick answer to that is all the time. Yes, very significantly. Yeah. Access to the health system and then navigating the health system is a significant amount of the requests or the things that people reach out to ask me about. And navigating the system is hard enough as it is, but trying to navigate it when most of it is remote is even harder. So yeah, it is a very common thing.
So with this in mind, you're preparing right now to bring some of these issues and these concerns to the provincial legislature, because you're going to be meeting with Nova Scotia's Standing Committee on Health on October the 11th. Can you give me a sense on what you hope to make in terms of an impact there, and what kind of information and data you're going to be bringing to help the province consider expanding what they've already confirmed they're going to be doing in the summer?
Yeah, the danger is that those that are not closely connected to this issue may think that they've done enough, when in fact there's an awful lot left to do. But I also want to bring in the idea that the overarching healthcare is not just about the health system, it's about other things too. It's about housing, it's about the issues in accessing healthcare, it's about the economics of jobs, it's about funding for prescriptions, and it's about finding other ways to deliver healthcare that better support not just those in the community that need access to gender-affirming care, but to be honest, those that need all sorts of healthcare. And the current model is not working for a lot of people. And also around things like name changes and the costs associated with name changes, which are really quite significant for some people. And that ought to change too. This is very often just a one-time event for 1.4% of the population at most. There really shouldn't be a good reason why it's costing multiple hundreds of dollars to do. So these are the kind of things that I want to bring attention to, alongside some others that are going to be presented to that committee.
And I don't think a lot of people in the general public might understand, Veronica, that all of these things are connected, that housing is connected, healthcare is connected, gender identity, misgendering, giving someone their wrong name or referred to as their dead name often. All of this links together, both in terms of general healthcare, but also gender-affirming healthcare and just basic mental and emotional health. So are you hoping to really drive that home?
I am hoping to drive that home. I mean, I see action in the world of mental health care, but I don't see a lot of action in some of the causes that go into that. It's all very well to expand your mental health care, but if you're not looking at, somebody's there because, somebody was dead naming them and it was the last straw in a whole pile of events that have led up to that the costs associated with being able to be who they are, or in general other health care, that ends up with them in residential mental health care, where that shouldn't be happening. There needs to be a systematic look at what's causing this, not just treating the effects.
Mm-hmm. Well, I wanted to ask you as well about how things have gone in terms of Pride events this year, and specifically, you have been to Port Hawkesbury's Pride celebrations. You were a guest speaker there on the waterfront, but at the same time, it's just been a few weeks since the Sydney Pride events took place. How do you feel those went, and were you buoyed by what you saw in Port Hawkesbury coming into the Sydney events in August?
The Sydney Pride was very hot. Let's start with that, shall we?
Yes.
But it was exceptionally well attended, and after a couple of years of not having anything, it was wonderful to see so many people out. It was nice to see more Pride events happening this year, where smaller communities are coming together to celebrate Pride, and Port Hawkesbury was one of that. I did another Pride at Antigonish that was well attended, involved the local school. So yeah, and the events generally in Sydney for Cape Breton Pride were well attended. It was really nice to see. It was busy. So those of us that were organising it had a lot of work. It was kind of towards the end of the week, the weather stopped a couple of our later events, but we are still looking at trying to run those. But the weather isn't quite being cooperative as it could be.
Well, obviously, we do have to contend with the weather every so often, but it still does seem like there was a lot of participation in the event. Sydney's been doing this for a few years now, so Port Hawkesbury and the Strait area really are very, very blessed to have a long-running event like this to inspire this particular community and the LGBTQIA community here. So I'm just wondering, what are your hopes for the future in terms of these types of events? Would you like to see them grow and expand? Would you hope to see them held in different communities? What are you hoping for as you look out over the next 12 months and beyond?
All of the above. Yes, it would be lovely to see the events that are currently happening grow again next year, but it's really nice to see other communities coming together and putting on Pride events. And I've seen that happening even in the last sort of 6 years that I've been in Cape Breton, that those things are starting to grow, which is beautiful to see, really beautiful to see.
Just as we wind down here, Veronica, one more question for you. You are the founder and head of the Cape Breton Transgender Network, and you also serve in the education position on the board of directors for Cape Breton Pride. So with that in mind, in addition to your upcoming appearance before the Standing Committee on Health, are there any things that either of these organizations are preparing in terms of the fall, in terms of educational opportunities for people? Essentially, what have you folks got on the go as we head into the next couple of months?
Personally, I have some other events that I'm attending and speaking at, but I'm looking to put on more, at least one or two more public events. The next big one will be the Transgender Day of Remembrance in November. I haven't got anything arranged for that yet, but that's the next one for me to arrange. I always find that one a very difficult one to speak at. So I have to be careful how I arrange that so it doesn't all fall on me. Last year, it was too much of an emotional load for me. So I'll have to figure that one out.
Yeah, that's the trick of doing this type of thing with any organization, that it has to be spread around and that the load does have to be shared. And I can understand that completely. All right. Well, we wish you well with these events. We've covered a lot of ground here in just a short time, Veronica, as I thought we might. Did you have anything else you wanted to add about any of this before we wrap up?
No, this has been good. You've asked all the right questions, and it's nice to get the opportunity. Thank you for the use of the platform and being able to speak.
Well, it's no trouble at all. And I always try to ask all the right questions. So I appreciate you giving me some time here, Veronica Merryfield. It's good to have you on again. Thank you so much for joining me again for Telile 24/7 today.
Thank you so much for having me.
Veronica Merryfield is the founder and head of the Cape Breton Transgender Network and serves in the education division on the board of directors for Cape Breton Pride. We've been speaking to her from her home office in Marion Bridge via Zoom. And there you have it. That wraps up this week's edition of Telile 24/7. Thank you for tuning in, and a big thank you to my interview guest this week, Veronica Merryfield. Thanks to Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang, for making himself available to reporters, including myself. And a big thank you to Communications Nova Scotia and the Province of Nova Scotia for providing the Zoom footage from that media availability with Dr. Strang. If you have any thoughts about what you've seen over the past hour, or you'd just like to make suggestions for future editions of Telile 24/7, I'd love to hear them. You can contact me directly. My home phone number is 902-625-8863, and you can reach me by email using the address adamjrcook, cook with an E, @gmail.com. You can also contact Telile Community Television directly. The station phone number in Arashat is 902-226-1928, and you can reach Telile by email using the address telile@telile.tv. Don't forget that you can also follow Telile on social media. We're on Facebook, Twitter, Instagram, and YouTube, and our YouTube channel features every single episode of Telile 24/7, including this one, as well as interviews and segments from our individual shows, plus editions of our sister programs, Roundtable and The Front Porch. For now, I'm Adam Cooke. Thank you very much for joining me for Telile 24/7 this week. I look forward to seeing you again next week with a brand new show. Bye for now.